Patients are often the end users of a lot of digital health technologies that we are developing right now. Their involvement in co-designing and their needs and their requirements are essential for these technologies to be accepted and effectively implemented and used.
Well, an important feature of pharmacovigilance is the self-reporting of safety events by citizens with the event cohort monitoring approach, where we provide mobile phone apps or websites that patients can report adverse events or experienced symptoms after vaccination. This is very important as a study design and data collection tool to create the real-world evidence that is needed for pharmacovigilance and thereafter.
Well, the one thing that I wish decision makers know and learn more about people living with health conditions, meaningful engagement, is that it's not enough to have generic social participation. You need to have people living with the condition under discussion, engaged, involved in decision making all the time, all the process of policies and programs that will affect them. I think this is the way not to invest on something that will be a waste of resources, because that's the only way that you really know what is in fact needed and produce a solution that will be impactful and will be welcomed by the community.
Patient experience data, or the use of patient experience data in medicine regulation, is a priority in our strategy. It's becoming an element in where we are investing resources because the agency wants to encourage developers to generate this data, which is reflecting the experience of the patients regarding a disease or a treatment, to ensure that it is included as part of the data package which is submitted for marketing authorization application. We are working on a guideline, on a reflection paper, which hopefully will be released to the public very soon, in which we try to express our position. I would say that our position is that we do want this data to be submitted, and we encourage developers, companies, to work early with patients and with us to ask for scientific advice, to discuss the best way to generate this data so that this data is systematically submitted. Because this data will help to understand better the effect of a medicine and will help to make the best decision possible.
This is really a big opportunity for patients to participate to the co-creation of guidelines, because guidelines are important to optimize the treatment of patients. So it's important to know which are the needs of the patients, what they expect from us, and what is feasible. It's also important to respect the different perspective of patients, the geographical diversity, and also the underrepresented population. The other important point in the preparation of the guidelines is the wording, because the wording can put the stress or the relevance of the recommendations we are doing within the guidelines. So if we say that something which should be done because it's based on the high level of evidence can have a completely different impact than say it's something you may do. So wording and what is the relevance of the patient's perspective in the wording is really essential, because patient can say that's not the way to talk, that's an unclear message, we don't agree with this recommendation, or if I were told in this way, I would be very scared. I would never accept this proposal of treatment. So wording, evidence, and strength of the recommendation are really important. Patients are essential to define them.